A diabetic's blurry vision isn't just because of old age, it's high blood sugar secretly destroying their eyes. Welcome back to the Dr. FICO channel, where we share practical, easy to understand knowledge to help you prevent illness, keep your eyes healthy, and live a long, happy life with your family. When it comes to blurry vision, many people immediately think of old age and natural aging. While it's true that everyone's vision fades with time, for people with diabetes, blurry vision isn't just about age. The biggest culprit is chronic high blood sugar, which day after day silently damages our eyes, what we consider the windows to the soul. The lens swells up like a warped camera lens. Your eye has a part called the lens. If you compare it to a camera, it's the lens itself. The lens helps light pass through and focus correctly so you can see a clear image. But when blood sugar is high, the excess sugar in your blood pulls water into the lens. The result is that this lens swells and becomes distorted, like a warped camera lens. This makes the images entering your eye blurry. This change can happen very quickly in just a few days of high blood sugar. Many people wonder, I could see clearly yesterday, so why is it so blurry today? This is exactly why. The retina, a leaky film. Behind the lens is the retina, which receives light, much like the film in an old camera. The retina is nourished by countless tiny blood vessels. When blood sugar is high for a long time, these fragile vessels become damaged, weaken, and easily leak fluid or bleed. When fluid or blood leaks into the eye, the film is ruined. A person with this condition might see floating black spots, dark patches that block their vision, or blurry light, as if they are looking through water. Abnormal blood vessels, a damaged fix. The body is smart. When it realizes the eyes are not getting enough blood, it tries to grow new blood vessels to compensate. But these new vessels are like patched-up pipes, very weak and easy to break. Instead of nourishing the retina, they cause more bleeding and retinal detachment, leading to severe vision loss. This is a major reason why many diabetic patients go blind if they are not treated in time. Cataracts and glaucoma, a dangerous duo. Not only that, people with diabetes are also at a higher risk of getting cataracts earlier than normal. With cataracts, the lens is no longer clear but becomes cloudy, as if a misty film is covering your vision. People see the world covered in a white haze that doesn't clear up even if they clean their glasses. In addition, diabetes can easily lead to glaucoma, where the pressure inside the eye becomes too high, causing pain and a heavy feeling in the eyes. When you look at a light, you might see a halo around it. If left untreated, this can damage the optic nerve and cause permanent vision loss. The stages of diabetic eye disease. Diabetic retinopathy doesn't appear suddenly, it progresses slowly through many stages. If it's caught in the early stages, treatment is often simple and effective. But if it's caught too late, the risk of vision loss is very high. 1. The mild stage. At this stage, the small blood vessels in the retina begin to weaken. Some spots swell up, forming tiny aneurysms. Some vessels leak a small amount of fluid, creating small yellow spots of fat on the retina. The person usually has no obvious symptoms, and their vision is still normal or only slightly blurry on and off. This is why many people don't know they have the disease until a routine eye exam. 2. The moderate stage. At this point, there is more fluid leakage and small bleeding in the retina. The person may start to see slight blurriness and sometimes floating black spots, like flies. With an eye exam, the doctor will see many small spots of bleeding and fluid leakage that cause retinal swelling. 3. The severe stage, proliferative. This is when many of the blood vessels in the retina become blocked, causing the retina to lack blood. These starving areas send out a distress signal, prompting the body to grow new blood vessels. But these new vessels are very fragile and break easily, which increases the risk of bleeding in the eye. At this stage, the person's vision is noticeably blurry, making it hard to read or drive, and sometimes they can only see a dark patch that blocks part of their vision. 4. The most dangerous stage. This is the most dangerous stage. The abnormal new blood vessels grow densely in the retina and in the front of the eye. Because they are so weak, they can break easily, causing heavy bleeding that leads to sudden, temporary, or even permanent vision loss. These new blood vessels can also pull on the retina, causing it to detach and leading to permanent blindness. This is also the stage where many patients have to go to the emergency room for a sudden, abnormal blurriness in their vision. Medical treatments for diabetic eye disease. Once diabetic retinopathy or other eye complications have progressed, controlling blood sugar alone is no longer enough. At this point, a doctor may recommend medical procedures to protect and preserve a person's vision. 1. Retinal photocoagulation. Laser treatment. This is the most common method for treating severe diabetic retinopathy. The doctor uses a laser to burn the abnormal blood vessels to stop them from forming. While it sounds scary, the laser is actually a very precise microsurgical tool that helps shrink or destroy the abnormal blood vessels, thereby reducing the risk of bleeding in the eye. After the treatment, the patient may see a slight glare, but most will stabilize after a while. The purpose of laser treatment is not to make vision clearer right away but to prevent the disease from getting worse. 2. Anti-VEGF injections. Locking new blood vessels. When many abnormal blood vessels are growing, a doctor may inject an anti-VEGF medication directly into the eye. VEGF is a substance that stimulates the growth of new blood vessels. When this medication is injected, it locks the signal, preventing the new blood vessels from continuing to grow. This reduces bleeding, swelling, and improves vision. A person may need multiple injections according to the doctor's plan, but the results are often quite clear. This is a modern method that is widely used around the world. 3. Vitrectomy surgery. The doctor will remove the blood-filled vitreous and replace it with another clear solution to restore the vision. This is a last resort to save vision when the disease is very severe. Vitrectomy is also used when the retina has detached due to scarring. 4. Cataract and glaucoma treatment. For cataracts, the doctor will often recommend surgery to replace the lens with an artificial one. This surgery is quite safe today and only takes about 15 to 30 minutes. After the surgery, vision often improves significantly. For glaucoma, the doctor may prescribe eye drops to lower the pressure or perform laser treatment or surgery to lower the pressure in the eye and prevent optic nerve damage. The important thing to emphasize is that these methods only work when the disease is detected early and treated correctly. If you wait too long, when the retina is already severely damaged, it's very difficult to regain lost vision, even with laser treatment or surgery. Therefore, a person with diabetes should consider a yearly eye exam, a safety insurance policy, for their eyes. The retina is the precious film of your eyes, but for a person with diabetes, it can be easily ruined by high blood sugar. Once the retinal blood vessels are damaged, your vision will get blurrier bit by bit, and if you wait too long, the light can go out forever. Don't let diabetes steal your vision. Control your blood sugar regularly, get a yearly eye exam, and listen for the smallest changes in your vision. Because if you catch it early, your retina can still be protected, and the light of life can stay with you completely. Thank you for watching the entire video. If you found this content helpful, please remember to subscribe to the Dr. Fico channel and leave a comment below to share your situation.